Welcome to the Humber River Hospital Community Town Hall and 5th anniversary celebration. Thank you for joining us. I'm John Derringer, and we're here with a group of talented staff and doctors from Humber River Hospital. I'll start off by introducing our panel today. Dr. Tasleem Nimjee, Physician, Emergency Department, and Senior Director, Medical Innovation. Nataly Farshait, Senior Director, Evidence-Based Practice Integration, Occupational Health and Safety, Infection Prevention and Control, and Dr. Brasg, Physician, Infectious Diseases. We're glad everyone on the phone and online could join us, and we look forward to speaking with you about healthcare, Humber River Hospital's response to the COVID-19 pandemic, our thoughts on the second wave of the pandemic, and the future of healthcare in our community. This is also a great opportunity for you to provide feedback and ask your questions. So a few housekeeping items. If you're joining us online, you can type in a question for us by clicking the question box on your screen. As well, you can dial *3 to get into the phone queue, and we will do our best to answer as many questions as we can. Well, I won't, but our 3 experts will. So for now, let's just jump right in. We'll start off with addressing, not surprisingly, a very hot topic in healthcare today, COVID-19 pandemic. I last joined you for a town hall on January 21st, and at that time, we knew of coronavirus, but it had yet to hit our shores. We did talk about how the hospital was prepared for infectious disease, so today is a good time to check in on how the last 10 months have gone and what we can expect. Everyone has been affected in one way or another by the global coronavirus. All of our lives have changed. We know the second wave is upon us, so let's start off by asking, well, we'll start first off with Dr. Nimjee. So far, how is the second wave of COVID-19 different at Humber and or different in the province? And if so, what are some of the changes that have been made at the hospital?
Thank you, John. So certainly, if we think back to wave 1 and where we were entering that wave, looking at what had happened in northern Italy and in New York. There's a great deal of uncertainty. So provincially, you saw much more sort of dispersed shutdowns of activities. Schools were closed, which of course is different this time around. And hospitals had to put in place a whole lot of new policies and procedures to ensure the safety of their patients and their staff as well. And so it was also the summer. So let's think about climate and how that impacts people as they deal with COVID-19. So people could engage in other activities, be active in ways outdoors, which again is different when we think of wave 2. And then the other big thing that stands out, of course, is long-term care and the preparedness that was required to keep our most vulnerable safe and the challenges that we faced and really tragedies that we faced in that sector. So if we fast forward now to wave 2 and we think about where we're at, certainly less uncertainty. And so from a hospital sector perspective, I would say I think people are feeling far more confident in their preparedness. The challenges are, of course, that we have seen an increasing number of cases far more earlier than we had hoped already, it being October. Certainly, we've seen those in our younger populations, but concerns that will now start to shift into older populations and how that will impact the hospital from a capacity perspective. Last time around, we really shut down services very quickly, again, for some of the reasons that we spoke about. So with wave 2, we are really doing our best to maintain our level of service to our patients as much as we can. And that means really having sort of a dimmer switch approach when it comes to surgical services, as an example. So we're back up to doing almost what would have been our normal capacity for surgery at this time of year. Have a lot of policies in place for how we would slowly dial that down if we needed to, very cognizant of how that would impact our patients and really wanting to maintain our level of service as much as we can. So there's that. And then the other thing I would say is that certainly we are leveraging our digital solutions and investing really in our care at distance strategy. And so that is really about maintaining level of service through other care delivery models, looking at the patient journey sort of from wing to wing and looking at registration, actual visits, virtual care visits, after the visits in terms of prescriptions and things, and how much of that can we automate to support care at distance when that is actually of benefit to our patients. And then the last thing I'll sort of touch on is the climate. So we talked about summer in wave one or spring, and now we're entering colder months, and that will absolutely impact our patients. So we think about the fact that influenza season is as fast upon us, and really pushing our influenza vaccine campaign. Because for our patients, they will need increased access to testing to tease apart those symptoms so that we can actually be able to test and isolate our patients that have COVID. And then also people are driven indoors during the winters. And so for people that are living in densely populated circumstances or congregate settings, that certainly allows for greater transmission of disease and spread. And so we're concerned about that in the winter and what that all means as to capacity for our healthcare system. So certainly a long answer, but I hope that answers sort of some of the differences between wave one and wave two.
Thank you very much, Doctor. We'll go with Dr. Brasg on this next question, and you touched upon surgeries and things that have to happen in hospitals, and with so much talk about coronavirus, I think for lay people like myself, it's very easy to forget that there are all kinds of other maladies and injuries and sicknesses for which somebody ends up in the hospital totally and completely unrelated to COVID-19. So the question, Dr. Brasg, a lot of people in the community are wondering, is it safe to come to the hospital, especially for things like surgery and emergencies?
Thank you, John. I think it's a very important question to be answering right now. I'll tell all of you what I tell my family, which is that, I really think the hospital is one of the safest places to be right now, safer than going to the grocery store or even the coffee shop. We have really world-class infection control practices at Humber River Hospital. The cleaning is really stellar and top-notch of all of our surfaces. We have very advanced air exchange capacity in our hospital, and what that means is that essentially we're recreating almost like what it's like to be outdoors, where the air sort of very quickly would get the virus away from patients who might have coronavirus. And so, aside from being outdoors, really, I think being in the hospital is almost as safe. We've taken great pains to train all of our staff on the important precautions to take with respect to wearing personal protective equipment, how to put it on and take it off safely, and just really sort of optimize our practices of moving patients around the hospital while exposing as little as we can to the virus. So definitely sort of on the side of safety from coronavirus from patients who might have that in our hospital, I truly feel so safe going into work every day, and I would definitely encourage that feeling of safety among our community. I think the flip side here is, the risk of delayed care for non-COVID conditions, and unfortunately, we saw issues relating to that in the first wave. As was spoken about by my colleague, we unfortunately did need to wind down care a bit as we were dealing with the surge of cases. And we have seen increased morbidity, complications from delayed care, delayed surgery. We've seen issues with mental health, issues with overdoses. And so, the complications of delayed healthcare have really come to the fore. So I think both of those pieces really come together to lead us to recommend, if you are ill, if you need to be in hospital, Humber River Hospital is a very safe place to be. And I would strongly encourage you to come in.
Our next question is for Nataly Farshait, and remember, infection prevention and control is part of what Ms. Farshait does at the hospital. So I guess it makes sense for us, again, as lay people, to follow not only the directions of medical experts, but also maybe pick up some of the ways that we in our own lives can mitigate the risk of coronavirus, because you're the health experts. Are there ways that we may not have heard about, or maybe we need to have resourced, that we in our everyday lives things that we can do to do our very best to prevent infection?
Thank you, John. Absolutely. In the face of the pandemic, we are as strong as our weakest link. And once we practice for many years in preparation for pandemics, global events, and outbreaks, and our staff is well versed in what to do, and our hospital has been built with the thought of pandemic preparedness, we actually need everyone in the community to participate. Public health put out some very basic measures such as social distancing, hand hygiene, staying home when sick, covering your cough. All those measures have been, they're not new, they have been in place for decades. The difference right now is every hand hygiene opportunity, every time you get too close to a person without wearing a mask, not complying with universal masking that we recommend right now in the community, can put us as a society at risk. So people who want to support each other's health, more so people who want to support Canadian economy, really can make a difference by following basic public health measures. They sound trivial, but they are absolutely essential. In the absence of the vaccine, I think that is probably the strongest line of defense that we have, and all of us participate in that response. At Humber River Hospital, we were able to respond to the first wave of the pandemic very quickly because we've been practicing for over a decade of how to respond to new and unknown viruses. It may be a little bit new for the community. However, it's very important that all of us participate in the same way, with the same due diligence and the same accountability for the spread of the virus. I'm also hoping that people who doubt recommendations from public health can put the doubts aside and just do the right things. Because while we're in the hospital, working around the clock, trying to keep the public safe, trying to keep our doors open, trying to respond to every emergency and change in epidemiology of the virus, we need all of our community members to feel closer to being the solution for the pandemic, to help us get closer to getting over the pandemic at some point.
Thank you very much. We'd love to hear your questions. I have one more for our panelists, but we'd love to get yours. And the easiest way on your screen is simply by asking a question, and we'll be able to ask that of our three experts today. As well, you can use *3 on a phone and have phone access to ask a question. And then in the second half hour, we have all kinds of people who are going to join us to wish a happy 5th birthday to Humber River Hospital. But one of the most important things, of course, remains the coronavirus. So I'd like to get all three of your opinions on this. And I know there is some guesswork involved, but it's rare for someone like me to have an opportunity to ask this of experts in the medical field. And that is, what do you see the future holding? And you determine what you believe the future that you want to talk about is. Could be a month, could be a year. But where do you see things going in light of what you have seen as medical professionals in the last 9 months? Dr. Nimjee.
Oh, sorry, I was on mute. I apologize. If only I had a crystal ball to answer that question. So what I would say is that, when we certainly look at previous experiences, looking at, from 100 years ago, when we look at the last time we were in a situation like this in terms of a global pandemic, we look at lessons learned from SARS. But the reality is that the world is different now than it was then. And this pandemic is very different from SARS. So we looked at modeling in terms of whether we're going to have a series of smaller waves, whether this will be like a slow burn, as people have called it, whether we will have 1, 2, maybe more very large waves. And I think, I'll allow Ian certainly to talk about some of that modeling and what we can expect, or what at least some folks are anticipating as we have these discussions. I think from a shorter term, what I would say is that there's a real concern. Nataly, my colleague, just spoke spoke about the importance of following public health measures. There is a real concern that while we were seeing this illness really spread in the last few months amongst our younger population, so those in their 20s, those in their 30s, that will trickle to those in our older sectors of the population. And that then means our more vulnerable sectors of our population. So when we look at today, for example, in the hospital, we have about 30 inpatients with COVID-19, about 12 or so in the ICU. And that number has already increased from where it was a month ago. And there is a real concern that that number has the potential to continue increasing if we're not able to decrease the daily increases in the province. And so I'm going to sort of use this question as an opportunity really to just reinforce the messages that you heard from my other two colleagues about really doing our part. We will do our part to ensure safety within the hospital, and we are impressing upon our colleagues in the community, our partners in the community, to do their part to keep us all safe.
Dr. Brasg?
Yeah, so really well said. I completely agree. Obviously, there's a lot of uncertainty here. I think sort of just more practically, we know where we're going to be for the next month or so, at least in Toronto, in our community. We are going to be in phase 2. My hope is that we won't need to pull back to phase 1, and I expect that to not be necessary. But at the end of that month, where will we be? Unfortunately, I don't think we're going to get numbers as low as we were able to towards the end of the spring and the summer for a number of reasons. The first is that quite appropriately, we've kept schools open. We're trying to prioritize the education of our next generation, and that will continue to apply upward pressure on case numbers. The second issue that I see is, of course, the colder weather. People will be less able to socialize, get exercise outside, even walk to stores, walk to work potentially. And so there'll be greater use of mass transportation, greater indoor activity. And again, I worry that will apply pressure on the upward numbers. So there's this concept of the hammer and the dance, where the dance is sort of the need to use testing, tracing of contacts, and isolating of confirmed cases to keep numbers down, while the hammer is where we need to enact more aggressive precautions like we've had to do right now with partial closure of certain higher risk settings. So we are going to need to keep doing that, I think, for the next little while, at least until some vaccines start to roll out, most practically probably in the early part of 2021. And then we'll need to take it from there. But I do think we'll have some viable vaccines coming soon. And certainly, once their safety is proven in trials, I will be front of line to try and get one.
And finally, Ms. Farshait, your thoughts, short-term, long-term, on what may happen here.
Yeah, thank you very much, John. I just want to echo to what Dr. Nimjee and Dr. Brasg mentioned earlier. I do want to say that on the bright side, pandemics are global crisis events, and it's definitely that it will bring our community and global communities closer, and we will create some positive social change going forward, especially within regards to some of the day-to-day health and safety measures that all of us can take. I would say that with their degree of confidence, handshakes are gone for a long time. So you have to look for an alternative way to greet people. I also think that reflecting on the past pandemics, although society changed and science has progressed quite a bit, we still find ourselves in a situation where there is no viable vaccine and a novel virus. So the previous pandemics, for instance, our pandemic in 1918 started in March and ended in the summer of the following years. It is quite possible that by the time we get a viable vaccine, it will be that long. So it's all on us, once again, on each and every one of us, to put our best foot forward, to try for our families, for our communities, for vulnerable people. Think about your grandparents, think about your neighbors, think about everyone in the community who depends on us doing some very basic public health measures every day, every minute of your life. We do depend on you, so please help us help you.
We'd like to take some of your questions. There is a question box on your screen. You can also dial *3 if you're on the telephone. This first question comes from Tat, and it follows up on part of what Dr. Brasg had already mentioned, and that is maybe having to be admitted into the hospital in an emergency situation and how COVID is avoided in cases like that. So from the emergency room, Dr. Nimjee, I'll ask you this question that comes from Tat. What is the current protocol for admitting patients with COVID symptoms? How do you prevent regular emergency patients from contracting COVID from potentially positive COVID patients?
That's a great question. So at Humber, we have one of the unique advantages of having been, it's a hospital that was built after SARS. So we don't have any shared rooms in the emergency department or actually anywhere in the hospital. We don't have ward style rooms, but in the emergency department specifically, this is very important. So patients that are coming in, first of all, have a triage. And so we are screening patients for what we call febrile respiratory illness or symptoms that would be in keeping with potential COVID-19. So once we identify that a patient could potentially have COVID-19, we're aware of that right from the beginning, and we're ensuring that those patients are not kept anywhere near patients that could potentially have COVID-19. Now, remember that the rooms are separate, and so we do have negative pressure rooms as well. And then also remember that anybody that's coming into the emergency department is masked, and we have social distancing even in our waiting room. So for those that are coming in that are actually presenting, that are ambulatory, as we say, so the walking well that are coming in, we still do ensure that we have social distancing in those areas. And then finally, people that are coming in to be tested are streamed to a completely different part of the emergency department for rapid testing and discharge, so they're not staying in the emergency department for longer than is necessary.
You know, one of the questions that was so top of mind when things began back in March, so much of what we did seemed to revolve around access to PPE. So please, any of the three of you who feels comfortable in wanting to answer this question, specifically relating to PPE, and it comes from Shirley, is HRH, the City of Toronto, the Province of Ontario, and Canada stocked full enough of PPE for a second or even third wave of COVID-19?
I can try to answer that question, John. I think that at the beginning of the first wave, there were two concerns. One was the fear of the unknown, and second was the question of the personal protective equipment. And although we were a bit at the rough start at the initial stages of the pandemic, we now are very secure about the amount of PPE that we have at the hospital to protect our healthcare providers, to protect community members. In fact, if you do have an appointment at Humber Hospital, we ask you to come with a face covering or a face mask. But if you don't have one, we offer one to everyone who has an appointment or comes as a visitor. We have a sufficient amount of personal protective equipment that we know works, because we've done a very good job during the pandemic wave 1 in protecting our staff and patients. Unlike many other hospitals, we're very proud of the fact that we did not have an outbreak on any of our sites or our units. We know what to do, and we just need to do more of it using the personal protective equipment that we have. And we do have enough of it for the second, third, or any subsequent waves that COVID may bring.
This one, not so much a question, but the kind of statement that I think anyone who works at a hospital likes to hear. It comes from William, who says, I've been here for a year as a patient, and HRH has done a great job on keeping me safe. I would like to thank all the people at Humber for that, and wish you the best through this phase 2. But the next question is another very important one, and that talking about how things might be caught up when it comes to the surgeries and treatments that had been missed during this pandemic. Is there any literal plan for how we get back to the number of surgeries and the time taken somehow even out and everything becomes balanced again? Is that a long way down the road?
Absolutely. I'll take a stab at that one. So we have so when I say that you asked, is there sort of a plan, a very specific plan? I think absolutely there is. So we actually have a group that meets regularly to look at volumes, and we look at volumes per division of surgery so that we can see where we were expecting to be at in terms of the cases that we were supposed to be processing, and then looking at the variance as we shut down and how we were actually going to sort of escalate our level of service to try to catch up. So it's not just about meeting new demands, the net new demands, but also being able to meet the needs of those patients who had to unfortunately have their cases delayed. And so, as I was saying earlier, we are back up at almost the same level of service where we would have been a year ago, so pre-pandemic at this time. And when it does come to actually looking at those cases that were delayed, we actually had a group of our surgeons, as well as our entire surgical team, looking at these case by case to ensure that we were prioritizing those patients that needed their surgeries most rapidly to get those through. So we increased staffing, we increased operating room time, and all of the services that we needed to be able to sort of address the backlog that we had.
This one comes from Powell and is really, a question that is asked so much by so many in every facet of our society. And this one comes as a bit of a surprise, but I suspect it does happen because Powell says that he has seen it. What is being done in the hospital to keep the integrity of wearing masks properly? I ask, as the food court especially, you see people not being compliant when it comes to their mask. Is that actually a problem even in hospitals? And Dr. Brasg, I'll ask you that one.
Yeah, thank you for the question. It's certainly very important right now for all of our staff and indeed our patients as well to be wearing masks whenever they can. We do hold very frequent educational events and training with our staff about the importance of wearing masks and how to do so properly. Of course, there are some times when wearing a mask is not possible, and one of those times is when you're eating or drinking. And so, we may be seeing staff taking their masks off in advance of having lunch or having a coffee. And that's expected, and that's what we need to do. Certainly, the cafeteria is a safer place to be eating than some of our break rooms. It's a wider space. There's more air exchange, and we know that break rooms have been a source of outbreaks in some of our peer institutions. So, ideally, we want to have 100% mask compliance. There are, important reasons for masks to not be on. That being said, sometimes there is some slipping up. Sometimes the masks are not covering the nose or not being worn tight enough. And again, it's just reinforcing that education, which we're working on quite well.
John,
please, yes, do.
Sorry, I was just going to jump onto something that Dr. Brasg said, and that was, when the comment about education is so key. So we see that all the time with patients in the emergency department that I might be sitting in front of that sort of lower the mask to speak or have it sitting just under their nose. And it's our job as healthcare professionals to remind people of why the mask sits where it does and why it's important to cover your nose and your mouth, and that there's air exchange from both of those places, and that it keeps the patient safe and it keeps us safe. And so it's reinforcing that message is so important. And we'll use that opportunity right now for those folks that are listening in about the importance of having it cover the nose, the mouth, and the chin, so that you can keep yourself safe and the others around you safe.
Yeah, and I just want to quickly add to that. We are entering a new normal, and mask is a reality that everyone has to get used to. We are strongly advocating for masks to be worn everywhere around the hospital, especially in the common places, such as food court And there are multiple sites that say no mask, no service. And we do try to encourage every visitor, and of course staff, is to get used to that new normal and follow it at all times.
I guess the new slogan is no shoes, no shirt, no mask, no service. Is what it comes down to in 2020. To all three of our wonderful panelists, Dr. Tasleem, Nimjee, Nataly, Farshait, and Dr. Ian Brasg, thank you so much for taking the time out on this Sunday to speak to those either already having dealt with the hospital, who may need to deal with the hospital, say in an emergency situation. Your input has been so greatly appreciated. And that brings us to the conclusion of the town hall today. We thank everybody who joined us with questions via the phone and also via your screen. And if you'd like to leave a comment, question, or if we didn't have a chance to answer your question during the call, you may email your question to communications@hrh.ca, or you can call 416-242-1000, extension 82256, to speak with our patient relations department. You can also get up-to-date information by visiting our website at hrh.ca or following us on social media at HRH Hospital on Twitter. We're also on Facebook, Instagram, YouTube, and LinkedIn. So coming up next, we have our 5th anniversary program with some very special guests virtually. So enjoy, and thank you very much on behalf of everyone at Humber River Hospital.
Welcome back, everyone. Great town hall, Humber River Hospital, lighting new ways in healthcare. Fantastic. And I just want to welcome everybody to our second portion of this great event. Today, we are now going to hear from our chair, Terry Leon, the premier of our province, Doug Ford. Mayor John Tory is going to be here giving us his best wishes. And then we're going to close it off from our president and CEO, Barb Collins. We have a lot to be grateful for. And we have a lot that we are going to be working towards as we continue this great legacy of Humber River Hospital. So it is my pleasure right now to introduce our chair of Humber River Hospital, Mr. Terry Leon.
Good day. I'm Terry Leon, Chairman of the Board of Humber Hospital. It's a great pleasure to be able to speak to you today about a very exciting event, our 5th anniversary. This hospital, as you can see when you've been here, is a beautiful physical building. But the physical building is only a representation of the people who work within it and the dedication of those people. Over the past 5 years, I can't thank enough all of our doctors, our nurses, our support staff, and our volunteers for the countless hours, the dedication, even at times at their own risk, to serve our community and to do everything possible to keep us all safe. We're very, very lucky to have such a beautiful community spirit that transforms this building into the service module that it is. And it's not just this building. As many of you know, we're part of a much larger community group, including our reactivation care centers, our COVID testing centers, our long-term care facility that we're now building, and so much more. And I just want to make sure that we don't forget to thank Barb, Collins, and our entire management team for all that they have done for all of us. As I said, we are a very lucky community, and I'm so happy to be a small part of it. Thank you all. Enjoy this hospital and all the people who work in it. It's a special, special gift to everyone. Thank you.
Hi, my name is Victoria. I've been working in Humber River for the past 18 years. I love Humber River because it's full of diversity. We have different ethnic groups and different cultures in the hospital. I love working here because we all work together as a team. And now, I would like to introduce a friend of Humber River Hospital, the Premier of Ontario, Premier Doug Ford.
Good afternoon. It's an absolute pleasure to be part of today's celebration. I want to start off by congratulating Humber River Hospital for 5 amazing years as North America's first fully digital hospital with state-of-the-art facilities and as Northwestern Toronto, Ontario health team partner. Humber River Hospital continues to deliver excellent patient care to 850,000 people right here in their community. I want to thank all the nurses, doctors, paramedics, PSWs, and hospital staff at Humber River Hospital for everything you do to keep our friends, family, and communities safe and healthy. I always am very grateful to Humber River Hospital for the great care my late brother received here as well, and the wonderful support to my family by the staff. You're all absolute champions. Keep up the great work. Thank you, and God bless.
Hi, I'm Sagar Desai. I'm an orthopedic surgeon here at Humber River Hospital. I started at Humber River Hospital when the hospital opened back in 2015. I was the first person on call here. I was the lucky one, and also I was fortunate enough to do the first surgery here at Humber River Hospital. I find Humber River Hospital to be a great place to work. I find that the staff, administration, physicians all work hard together to provide patients with the best patient experience overall. From a surgical perspective, we're given the innovation, the technology, and an amazing place to provide excellent surgical care. And from an anesthetic perspective, our anesthesiologists have great technology and expertise to provide patients with amazing perioperative care as well. So from my perspective, I think Humber has the best of all worlds, provides patients with an excellent patient experience, and I'm very lucky to work here. And I have the honor of introducing everyone to a friend of mine, a patient of mine, and a very close friend of Humber River Hospital, Mayor John Tory.
Hi, Mayor John Tory here. You know, if you want to know how much I think of Humber River Hospital, look no further than where I had my own leg surgery done, courtesy Dr. Desai. And if that isn't enough, look no further than where my one and only daughter, Dr. Susan Tory, works. I'm so proud of her, but I'm also really proud of where she works. And that's because Humber River is rapidly becoming better and better and better known as a place of quality care by quality people and a place of compassion, where, for example, your team really stepped up to look after some of the residents of long-term care who were really struggling during the pandemic. So happy 5th anniversary to Humber River, and thank you to the whole team for the excellent, caring way you look after Toronto residents in pandemic times and all the time. Thank you and happy anniversary.
Hello, my name is Irene Balkin. I've been a volunteer for 51 years at Humber River Hospital. Humber River is my hospital, and I like to volunteer because I like people and I like to help. And it's my pleasure now to introduce our president and CEO, Barbara Collins.
Welcome to the 5th anniversary of the opening of the Wilson site of Humber River Hospital. I'm Barb Collins, President and CEO, and on behalf of our staff, our physicians, and our volunteers, I welcome you to our celebration today. I want to thank our Premier, the Honourable Doug Ford, and our Mayor, John Tory, for having brought greetings as well. Both of you have been very supportive of Humber River throughout our journey. In the year 2000, when Dr. Devlin suggested to the Board of Directors and the hospital staff and physicians that a new building on a new site would be the only way to change the future for Humber River Hospital, there were many who were skeptical, some of who were on board, and some of who were just worried. 15 years later, we were able to move into North America's first fully digital hospital in honor of his vision and in honor of the hard work and the effort he put in to ensuring that we would get here. 5 years later, were he still here with us, he would be very proud of how this organization has grown. Over the past 5 years, Humber River Hospital has revolutionized the patient experience in quality and safety. On October 18th, we opened our doors as North America's first fully digital hospital. We embraced a bold new vision for the future of the hospital care and patient experience. Our hospital was designed to put patients first, with comforts and convenience never before integrated into a medical facility. Our Wilson site maximizes the benefit of digital technology, sustainability, and professional learning so that our hospital can be responsive to the ever-changing needs of our community and the healthcare landscape. In 2016, when I became the hospital's new president and CEO, I wanted to build on the successes of Dr. Devlin's vision for patient-centered care and further propel our hospital and staff towards excellence in the patient experience and satisfaction. Our culture of excellence is best seen in the respect and the compassion that our physicians, nurses, and healthcare staff have in treating patients every day. In 2017, we launched Canada's first command centre in partnership with GE Healthcare Partners. In Phase 1, we leveraged professional expertise to improve operational flow, including capacity, safety, quality, and wait time. We have never had hallway medicine at Humber River Hospital. Our command centre helps us to ensure we stay that way. Since we've unlocked inpatient capacity to the equivalent of 35 beds and reduced emergency department wait times despite experiencing an increase in volumes every day during this same period. In 2018 and 2019, we continued to leverage state-of-the-art technologies, like using the Da Vinci robotic surgical system to perform the first ventral hernia repair in Canada, and also Pepper, our friendly humanoid robot, to comfort and educate our younger patients. We also introduced Phase 2 of the Command Center, where we launched the world's first clinical analytic tiles to collate and monitor patient data, to improve patient care, and to provide a safety net for quality of patient care. By embracing innovation, our incredible teams of healthcare professionals can spend more time at their patient's bedside, delivering an even higher standard of quality patient care. We also reopened the reactivation care centers at Church and Finch site. They are now fully operational with partner hospitals from Toronto and York region. We safely transition patients from acute care to alternate level of care, providing them a higher level of physiotherapy, occupational therapy, and activation. This year, the healthcare community met our greatest challenge yet with COVID-19, and we rose to that challenge. Since opening one of Ontario's COVID-19 assessment centres, we have performed 65,000 tests to date. We swiftly introduced COVID-19 tile in our command centre in just over a week to support early response from our frontline professionals. Since we opened these doors 5 years ago, every achievement and milestone has prepared us for this moment. From our hospital design to our innovative technologies, most importantly, our unparalleled staff, physicians, and volunteers, whose courage and commitment has shown no bounds during this unprecedented time. Over the past 5 years, Humber River Hospital has been a leader in community and globally. The results speak for themselves. We were chosen as part of Northwestern Toronto, Ontario Health Team and have built partnerships with Sick Kids, with Runnymede Healthcare Centre, Black Creek Community Health, and the Registered Nurses Association of Ontario with their Best Practice Spotlight Organization program. We are also proud to be overseeing the construction of a new long-term care centre here in North York at the Finch Avenue site. It is in partnership with the Ministry of Long-Term Care. As we look ahead to the future of Humber River Hospital, we stand committed to delivering an even higher standard of care, and we are excited to continue lighting new ways in healthcare. Thank you to all of you for attending Humber River Hospital's Wilson site 5-year anniversary. On behalf of Terry Leon, the chair of our board, and our board members, I want to thank our physicians, our staff, and our volunteers. Your dedication, your commitment, and your hard work every day for great patient care at Humber River is truly valued. And now we look forward to lighting new ways in healthcare.
The Access Live event has ended.